My perspective on employers is that, this is multiple years that they've had these 7 to 9%, projected cost increases. Many people are obviously talking about how that's unsustainable. Pharmacy costs keep rising. GLPs are always one of those top concerns for employers. And then a lot of employers have also just pushed those premium increases onto the employees. And, not everyone can obviously afford that. So there's the affordability crisis.
The CEO who sees the holistic business and the issues and challenges tends to be very open to why wouldn't we look at that different approach, or why are we not considering that? If that's going to save X amount of dollars, let's take our blinders off and open our minds and hearts and see if there's a better way to do this.
From a consumer, I think people forget a lot of the time that, the way that the employer market works is really kind of a B2B to C model, with the C being the patient or the employee. And so if you can drive simplicity for the individual, then they're more likely to utilize the solution, right? Hello, everyone. Thanks so much for joining today, and welcome to the Spark Spotlight podcast series. Today, I have Rick Elliott with me, who is with Lockton and is the People Solutions Consultant at Lockton. And we are going to talk today about healthcare today, and if it's time for disruption. Rick has a fantastic background working with large employers in multiple different markets and representing a lot of kind of large brokerage firms and health insurance carriers. So I'll kick it over to Rick to tell a little bit about his background and set the stage.
Hey, Lindsay, good to see you again. Thanks for having me. Great to be here. So as you and I have talked, I have over 40 years experience in insurance, employee benefits, healthcare, all sorts of jobs. Right out of college, I got into underwriting and the financial side of insurance, and then got into sales and consulting. And as my career grew, I got some really fun leadership jobs. I ran a health plan in Georgia for one of the major insurance companies. I was CEO of the employee benefits brokerage services for one of the large consulting firms, kind of everything in between. But really for me, the last almost 12 years at Lockton, I've been sitting across the table consulting with clients, mid-sized and large companies with complex HR issues. And so, really rewarding for me to kind of be back on the street level, dealing with day-to-day issues and strategy and supporting organizations, managing complex HR issues. So a lot of time in the business and really love what I'm doing now.
Yeah. It's so interesting working with kind of those large employers and the mid-sized employers and seeing, like, to your point, like on the ground, like what are some of the challenges that they're experiencing? I had the opportunity to do that for many years as well. And I really enjoy just kind of working with those HR leaders and hearing about what's going on. So maybe kind of building off of that to set the stage, would love to talk a little bit about like what you're seeing working with employers now that's kind of current for 2025 and beyond. And really, as we think about this, my perspective on employers is that, this is multiple years that they've had these 7 to 9%, projected cost increases. Many people are obviously talking about how that's unsustainable. Pharmacy costs keep rising. GLPs are always one of those top concerns for employers. And then a lot of employers have also just pushed a lot of, kind of those premium increases onto the employees. And, not everyone can obviously afford that. So there's the affordability crisis. So there's just a lot going on with employers today. And it seems like many are having to think more and more creatively about how to bring down that cost trend, because, it's not necessarily sustainable for their business. So would love to kind of hear your perspective on, the employers that you're working with today. What's really kind of top of mind for them, and what are some of the concerns that they have today?
Yeah, it's a great question. And, I would always start any conversation around that by you reminding us all that every company's different, every business is different. I deal with governmental clients, nonprofits, publicly traded, privately held, private equity held, venture-backed businesses. And so there is no kind of, one answer for every employer around what their key issues are or what's driving their business decisions. But I would say, having said all that, there are a few common themes that tend to be very important in today's conversations with our clients. And certainly compliance is top of mind and very important. Nobody wants the DOL to show up and start snooping around and finding compliance issues and problems. And so, kind of baseline of making sure plans are in compliance, deadlines are met, filings are done properly, all the written materials, communication materials, et cetera, comply. And so it sounds kind of boring, but that's really important. And kind of a subset issue on compliance is really, I'd say in the last 5 years or so, a greater attention around state leave laws and, clients that have multiple locations, just trying to manage the various leave laws that have been changing dramatically, almost daily, depending on sort of the attitude or what's going on in each given state. So those compliance issues really are kind of a starting point with a lot of our clients. And then two probably more obvious kind of baseline similarities with most of our clients: healthcare cost, which is what we're going to spend a fair amount of time talking about today, how to manage those, what's going on, what are the tools and resources clients can use to better manage their healthcare costs. And then kind of overlapping all of that is just recruiting and retention. It's still a very tight labor market all across the board for our clients trying to recruit and retain talent, ranging from manufacturing to high tech and financial services. And so all of the decisions, all of the strategies are all wrapped around, making sure our clients have the right people in the right chairs and can recruit and retain talent to help them grow their business. So again, every company's different, but those are just kind of three areas that seem to be, very important in every conversation we have with our clients.
Yeah, I'm glad to hear you mention, recruitment and talent. I feel that, some people think of that as like a little bit more of the like softer side of, healthcare or selling a solution into kind of a new employer group. But it's also super important for so many different employers. So just curious, I mean, I think it makes sense what you said about every employer is different. I think that's oftentimes something that is missed with people that, this isn't just like one homogeneous market, that every employer is unique and has different concerns. But for those that are facing a bit of a talent, crisis or challenges trying to recruit kind of top talent in certain markets, are you still seeing benefits being a pretty big differentiator for those organizations?
Absolutely. And again, as we get into the tools and resources around managing healthcare costs, again, that's a very important underlying issue that applies to almost all of our clients, which is if we're going to tweak our health plan or make dramatic changes in our health plan, and I look forward to getting into that with you this afternoon, how is that going to impact our ability to recruit and retain? And so, yeah, short answer, yes, it's part of every conversation. Again, if you think of manufacturing, very, very difficult recruiting, retaining, attracting, getting people to work late shifts, all of those kinds of issues. Healthcare, huge battle for talent with clinical care providers. So yeah, it's right at top of mind for all of our clients.
Yeah, so I would guess then kind of given the different types of employers that you work with, then, really aligning with their HR team and their benefits team around what's important for their organization is probably one of the first steps that you kind of recommend in the process, and really kind of rolling up your sleeves and getting to know the client and what's going on with them. So anything you'd like to say there?
Yeah, alignment's an interesting and I would say underrated component of the HR function within the clients that I work with and have worked with over the years. It's not unusual for a client to have a small team that's evaluating benefits, compensation, overall total rewards. And my goal is always with the clients I work with is to expand the room a little bit as much as we can. A perfect, strategic planning meeting for my team and our clients would have HR leadership, benefit leadership, CFO. My favorite meetings are when the CEO is in the room. Oftentimes operations are in the room, or probably not enough. And so, yeah, again, when you think of structuring an HR strategy, benefits program, I just love when the whole contingent of leadership from the organization is involved. And it's even better when it's on the front end. It's not unusual for us to work with an HR team. We go down a path of potential changes, solutions, remedies, ideas, and then other parts of the leadership team come in later and they've kind of missed all of the kind of fact finding or evaluation or analytics that went into that. And we have to start over. So yeah, long story short, getting leadership aligned around all of these issues is really important. And again, kind of underrated in my mind in terms of how an organization can make the right decision for their company, their employees, their culture, et cetera.
Yeah, I think that's a great point. I know that in my past, working with large employers, especially, it's not uncommon to get kind of pushed down over time or throughout the sales process, or when you're actually working with a company to like a benefits manager or somebody that's still important within the organization, but doesn't necessarily have that decision making, authority. So I think it makes a ton of sense what you're saying about, where you can get the leadership in the room early, that really dictates a lot of things because they're thinking about things from a very different perspective oftentimes.
Yep, super important. And I always push for that. Sometimes more successful than not. But again, the more people in the room, the better.
Yeah, for sure. Shifting gear maybe now to like kind of like what's broken within the system and then, how employers have the power to change this. Would like to talk a little bit about that. So obviously, when you think about the healthcare system, employer sponsored, insurance was, perhaps a second thought. I think a lot of people know that kind of started during World War II. And so it wasn't really built for employers and then with employees in mind originally. And then you have all these different players that are involved, so you have, TPAs, you have carriers, you have the PBM, you have brokers, you have all these different people that are involved, that all have different incentives in working with employers. And so, then you also have employers who, some are more open to change than others and are more willing to be disruptive than others. And so you kind of end up in a situation where, employers need change, they want change, but the system is not necessarily set up to allow them to implement some of these bigger changes. And it can be scary for everyone, right? So would love to kind of hear your perspective on, how employers are maybe like unknowingly supporting these legacy systems, and a little bit about, your thoughts about what they can do to start driving some change within their populations and their health.
Yeah, fascinating question, thought process. Just a few kind of preliminary comments that the U.S. healthcare system is very complex. My friends and neighbors who know that I do this for a living are always asking me at the backyard barbecue, like, why is this so expensive? And there is no simple answer, right? And one sort of adage that I often lean on is, when healthcare is for somebody else, it's an institution. But when it's for you or your family, it's a religion. And there, points to, I think, one of the basic challenges in fixing a system, whether it's broken or needs to be fixed, is that it's great to have all these wonderful ideas that impact everybody else. But hey, for me, I want the best doctor at the best price and the most access to care, et cetera. And so all of those factors make this a very complex, dynamic market for healthcare services in the U.S. Having said all that, we get phenomenal healthcare as citizens in this country, miracles performed every day, lives saved, new drugs, right? All of the great things that come out of very bright, intelligent people that deliver all this care. Yet somehow we've got to figure out to afford it. And to your root question, the employer side, where I've spent my whole career, who basically fund all of the commercial insurance in the United States. Again, the beauty of what I do today is I get to sit in the room with lots of really different, bright people. And I would say, there's still a very high percentage of organizations that I work with who find healthcare expensive. It's a pain. They don't like that it's going up, but it's not within their organization something that's on fire that needs to be changed immediately, right? And there's lots of factors that go into that. Again, competition for employment. Some of my clients, their businesses are just performing very well. And, if they get an increase in their healthcare costs, they can absorb that. And it's not that high of a pain point. They don't like it again, but it's not something that they sit around thinking about dramatic changes. And then probably the bulk of the clients I deal with are sort of in the middle of the spectrum. They're tired of these increases. They want to do something about it. They don't see their organization as leaders of change agents in fixing the U.S. healthcare system. And in that case, they're doing more things around the edges. Certainly smaller employers that are looking at self-funding today as a way to kind of get better control of their costs. And then starting the process of carving out from the traditional players, things like stop loss, pharma, PBMs, point solutions. And so I would put all those in the category of making adjustments and important ones, but not waking up wanting to change the world. And then the third category, which is really where I get the most excitement about at this stage of my career, is working with clients who do want to change the system. And that typically comes about for a couple of reasons. One of which, they feel like the system is rigged against them and they're tired of it. And number two, they simply cannot afford the current structure of their health benefits plan, right? They might wake up saying, I wish we didn't have to do anything, but in our business with our margins or whatever's going on, we just can't afford it anymore. And so come to us with radical ideas, Rick, that we're going to take a very hard look at. And I would say, this is the debate going on in our industry today. Are we at the tipping point where more and more companies are going to step into that third category and say, this is just no longer sustainable. Let's make dramatic changes. And we're seeing that with a small number of clients that are ready to step into the deep end and do something different.
So are you seeing an increasing number of clients that are open to driving more radical change? Just curious, like you said, that's something that is growing in awareness, but, people are still hesitant. So just curious if you're seeing more kind of jump on the bandwagon.
Totally. Yeah. And even if it's in the context of at least show us what these outlier ideas are, these out of the box thoughts are, what are these innovative companies doing? We may not be ready for it, but we want to understand what's available in the marketplace and we want to take a hard look at it versus, maybe 5 years ago, we would never even look at something like that, X, Y, or Z. And back to the earlier point, the reason I love having more people in the room, and particularly the CEO of an organization, don't want to stereotype or generalize, but the CEO who sees the holistic business and the issues and challenges tends to be very open to, why wouldn't we look at that different approach? Or why are we not considering that? If that's going to save X amount of dollars, let's take our blinders off and open our minds and hearts and see if there's a better way to do this. And so to your root question, yeah, it's more prevalent, more and more of those conversations, some actually jumping in and doing it, but more and more companies taking a hard look at, sort of revolutionary approaches to how healthcare is paid for.
Yeah, it's interesting your point around the CEO getting involved and looking at things more strategically. Benefits are oftentimes like the second largest expense after labor for many of these organizations, yet it's managed and thought about very differently than other, huge cost drivers for an organization. So, I always urge clients that we work with to make sure that you have kind of the financial story, really down, where you can talk about the ROI and the cost savings and how you're really helping the employer from a financial buying perspective. But I think it's interesting that you kind of mentioned that the CEO, is oftentimes going to think about this more strategically than if you, don't necessarily have somebody at that level of the organization involved in the conversation. Any thoughts on why, those CEOs are not always at the table, or why this isn't something within a lot of organizations where they are thinking as strategically or as aggressively about how to manage it, given kind of the size of the cost that this is for most employers?
Yeah, again, having the opportunity to sit down with organizations of all walks and colors and shapes and business models, I think it really just comes down to the personality and style of the CEO. For all the right reasons, many CEOs delegate to their CHROs, chief people officer, their CFO. Look, you guys figure this out. Come back to me with your recommendations. Maybe that's just more of a leadership style. Where others, and again, more and more to your point, are saying, if we're spending this much money, I kind of want to be in the room when we're debating, discussing, looking at options, et cetera. So I can't say for sure, but to me, it's more kind of a leadership style issue.
Yeah.
And again, in some cases, being forced to be part of the conversations because the organization simply can't afford the current model as it exists, right?
Yeah. Well, that's a good sign. Then you would hope that there would be more engagement at kind of the upper executive levels of the organization, as it continues to be, a really big problem for employers, and maybe that's more likely to drive some change. Shifting gears, you talked a little bit about, the disruptive employers, those that really kind of get you excited working with. I similarly have had kind of the benefit of working with some of those jumbo employers employers that are looking to do something really different. I lived in the Bay Area for a long time, so you had the opportunity to work with a lot of the tech employers in the area. And, at that time, they were very focused on kind of the recruitment and retention and having, very rich benefits for their populations. But of course, to your point, every employer is different. So would love to hear about, as you have employers that are looking for disruption or to do something really novel or drive significant change, what are kind of those levers or those recommendations that you would typically make? And what are they typically most interested in hearing about that you think can actually drive some meaningful change for them?
Yeah. And one thing I try to do, and it's such an important part of this discussion we're having and any potential change in an organization, it's right in the first sentence of every conversation with clients. And again, for all the right reasons, their starting point might be, we do not want disruption. We're going to absorb cost increases, maybe more or faster than others, because in our culture, disruption is something we want to avoid. So I get it, makes sense. And I talked about kind of different stages of organizations within that. But part of what I'm trying to do when I discuss this publicly or with clients is kind of reshape the definition of disruption. Because unfortunately, and I'm at the stage of life now, I have adult children who are starting families and saving money and putting 401k money and, trying to buy a house and all those kinds of things. They don't have, $5,000 sitting around for a deductible. In fact, we know a very large percentage of the US citizens don't have savings. And so to me, the definition of disruption needs to be looked at a little differently around this notion of if we don't make any changes and we're kind of passing along a lot of the cost component, either in the form of higher payroll deduction or deductibles or coinsurance, the disruption becomes very real to somebody making $15 an hour or $70,000 a year, whatever, in trying to be able to afford healthcare. So I like to get started with that part of the conversation around let's think of what disruption really is. And then if we agree that many of our clients' employees simply can't afford the benefit plan that's structured the way it is in their company. And I would say employees are tapped out for future increases, deductibles, coinsurance, out of pocket, payroll deduction. We're almost done. There's just no more room to do that. And so that leads us to your question of what does disruption look like when you start reinventing the way healthcare is delivered. The simple starting point is, price times volume equals cost for most businesses and certainly in healthcare. And so the beginning conversation of call it disruption or a new model, in my mind, starts to bring transparency around price, simplicity around how things are paid for and charged for within the healthcare system, and then empowering the patient to have a very significant role in the healthcare they choose, understanding the price, understanding the clarity of how their bill will be structured, et cetera. And long way of saying there are models that are, evolving in healthcare that are starting to do those kinds of things, bring transparency, measure price, make it simple, and give the employee the power to choose or select how they want to, engage into the healthcare system versus the traditional, I've got my ID card, I go to the doctor, I go to the surgeon, the person at the front desk takes it. I have no idea what it costs. I don't really understand the explanation of benefits I get. I just know I got some bill for my portion of it. So there are really cool, innovative companies that are starting to get at that, and we can chat about those.
Yeah, I think that that's very cool because I mean, obviously, with kind of the explosion of so many digital health solutions and things, there's been this engagement problem, right? And everybody's like, how do you solve this engagement problem? Well, one way is to, make sure that employees, to your point, are empowered to utilize those solutions that they think are going to actually, be the most beneficial for them and have some sort of a stake in things, especially to your point, with the affordability challenges. Healthcare is very expensive for people. So how can you actually get them better healthcare for their money. You also mentioned transparency, which I think is great. There's obviously been a lot of discussion around transparency within the healthcare world, especially the PBM world. I know there's a lot of transparent PBMs that are popping up, but would love to kind of hear a little bit more about what you're seeing resonate with employers around transparent solutions, and what they may be looking for there.
Yeah, and the simplest place to start is in the PBM world. I'm not alone in pointing out the way prescription drugs are manufactured and distributed into the U.S. healthcare system, again, within the commercial insurance world, is about as confusing as any business model you could ever imagine. And, there's a lot of really bright people trying to change that. There's been some really fantastic new companies emerge that we call transparent pass-through PBMs. They're getting out of the business of spread pricing. They're getting out of the business of making profits from the rebates that should go back to the employer at 100% and providing just pure clarity. They charge an administrative fee to manage the PBM. And then everything else is clear and transparent to the client. There's a movement to certainly move away from the whole world of rebates. That's going to take, a pretty powerful shift in the marketplace. I, for one, don't understand the value that rebates provide to the consumer in the way the current structure is. And again, there's a lot of really smart people creating and building and having great success with these freestanding, transparent pass-through PBMs. Add to that just the chatter on social media. You've got Mark Cuban screaming from the top of the hill to change. He's built his own company around transparency for generic drugs. And then you've got legislation pending, state, federal, to try to take away the black box of PBMs. And then finally, litigation. We're all seeing these class action lawsuits against large employers about trying to help the consumer, the patient, the employee understand why a drug that they need for survival is $1,000 at one retail store and $20 at another. Yeah, the PBM world is getting the most attention, probably seeing the most early success around transparency, clarity, giving, the patient power to understand how the cost structure works. And then more broadly on healthcare outside of PBM, you want to dive into that a little bit?
Sure. Yeah, would love to. Go for it.
Yeah. So a couple of things that have happened used to be, the enemy in most of my clients' conference rooms, reference-based pricing, starting to get some traction. I think the business model has evolved. And in that world, basically, an organization will hire a third party to price out a service, mostly on the facility side, the hospital or outpatient center, and say that, this particular company can no longer afford to pay you 4 times Medicare for what you charge, or whatever the current reimbursement might be under a traditional health insurance plan. And we're going to negotiate a lower reimbursement that we think is fair for you and is fair for our client. And so, a lot of traction around that simple model of paying less and then finding those employers that are interested in reducing the amount they pay for a service and balancing that against hospitals and healthcare systems that say, oh, we'll take that. That is a way oversimplification. In the middle of that is a patient trying to, get the right deal for themselves. But anyway, yeah, so reference-based pricing, as we wrap up, I can share a success story around that. And then just some really innovative models, a company called Curative sort of emerging. They're building their cost management around getting out in front, having employees participate in a really kind of robust process of spending time with a clinician about their own healthcare, the drugs they're on, what they do, their lifestyles. And then if they're willing to participate in that kind of initial assessment, their premiums go down, they're managed, they're monitored, they're coached. And then another kind of one of my really favorites is a company called Sidecar. And Sidecar is emerging as a really new innovative product. And essentially they turn every consumer that's covered by their insurance plan into a cash buyer. They give them a Visa debit card, and they reimburse the providers at essentially the 50th percentile in a given zip code and diagnostic code. And the patient just pays at the time of service, swipes their card. Providers love it. There's no claim form. There's no pre-authorization. And then if the employee happens to choose a provider that charges less than that 50th percentile, they participate in the savings and actually get cash back. So just a couple of examples that are kind of really cool things I see that are in the category of, beyond disruption. They're changing the way health insurance is structured.
Yeah, I think that that's great. And I love kind of the example of sidecar too. I mean, I think that goes back to your simplicity, comment too, because like from a consumer, I think people forget a lot of the time that, the way that the employer market works is really kind of a B to C model, with the C being the patient or the employee. And so if you can drive simplicity for the individual, then they're more likely to utilize the solution, right? And, I know that like, benefits is just something that a lot of people find really overwhelming. Like, even like my husband, really smart guy, he's a founder. He is always like, Lindsay, can you like figure out the healthcare stuff for everything? Because I don't really understand how all this works and you do. So, I mean, it's kind of crazy when people who are really successful are still having a hard time understanding healthcare and benefits and how all of this works. So, I totally agree on the simplicity point as well. I think that that's very much long overdue, and obviously not something that people have, traditionally experienced with the healthcare system. So,
Yeah, and we have a whole generation of, millennials, X, Y, Z, that are confused by the fact that shouldn't I be able to just look all this up on my phone and find out what it costs and make a selection from that? And obviously all the major insurance companies, as well as some of these innovators, are quickly and rapidly moving towards self-service. But still work to be done there. And again, some of these new models are really empowering the patient to figure out the best care at the best price.
yeah, yeah. You mentioned examples, and that, you had an example on kind of a success story with reference-based pricing, but would love to
Yeah.
kind of hear any like real world examples from working with, clients of things that you've seen succeed and really kind of pick up traction.
Yeah. So I've had probably a half dozen clients adopt the reference-based pricing model in the last, say, 2 or 3 years. And one, back to my criteria, it was a company that just really, was forced to rethink how they provided very expensive healthcare. They tended to have an unhealthy population, tons of turnover, and they just said, bring us something different. And it took about a year to kind of walk through what reference-based pricing was, how it would work, a lot of trepidation, and they rolled it out. And they had a pretty big price differential. So an employee who chose the reference-based pricing plan paid much less on a monthly contribution basis than the traditional PPO plan. And they had a flood of people that bought it. Like 80% of their employees enroll in it. And, first 4 to 6 months were super bumpy, a lot of confusion, questions, calls. The client ended up hiring a full-time person just to sort of manage the employee engagement part of it and help them get their questions answered. And, it's been up and running for almost a couple of years, saved them literally over $10 million.
Wow.
And employees have figured it out, and it's working. So not right for everybody. Again, it's not that simple in a 3-minute description, but an example of a client that's really satisfied and appreciative that they tried something different, and it's allowed them to continue to provide a competitive benefit package.
Yeah, I mean, that's a win-win. It's less expensive and the employees end up being happy with it. So,
Right.
that's obviously like the holy grail for employers, right? They want to spend less, but they want to provide, good care for their employees and have employees who are happy, because otherwise they come screaming to HR, right? So, they need a way to manage that. And I think that that's something that everybody should keep in mind when they're selling into this market, that is, and their, satisfaction with the service is really, really important to the success of any type of solution.
No question. Yeah. And back to my definition of disruption, I hope we move to a position where, we're more comfortable explaining something different to our employees and help educate them versus just passing on the cost increases because we're nervous about, their ability to absorb a different model or a different structure for healthcare. Because again, in my opinion, they're tapped out. They can't take higher deductibles and higher monthly contributions.
Yeah, I love that point, Rick. Would you maybe, kind of back to the examples again, do any examples come to mind for you of, employers kind of similar to the reference-based pricing example, but like where they have been willing to do something different in terms of communication to their employees, and that has worked? Because I think that that is a huge challenge facing employers, to my point around like, they don't want to have people coming to them unhappy, but it keeps them from, really kind of breaking out of the mold and doing something different. And, in this situation where they have choices, if something is a well thought out, well implemented new benefit or change to kind of their existing structure, change can be a good thing and people can embrace it and their employees can embrace it. But it has to be really thoughtful in my experience. Any thoughts there?
Yeah, no question. And I would say the simplest example is employers that are carving out pass-through transparent PBMs, right? And part of the discussion often at the front end of that is how are we going to explain this to the employees? They're used to having only one ID card, same insurance company that does the PBM. I don't like the idea of having them, with two ID cards in their wallet. These are all valid communication challenges. But to your point, you kind of dive in, you accept that there are going to be changes. And then employees get used to it and they like it. It's better cost, better transparency. They understand it. So yeah, I mean, there's all sorts of examples of just getting over that discomfort of doing something different. And again, I'm not being critical of organizations that don't, because they all have their own culture and their own style, and God bless them. But my job is to make sure we're thinking about everything we can and make the right decision for each organization.
For sure, for sure. I love that you take such a collaborative approach and it's, obviously very tailored to the individual organization. Well, thanks so much for coming on, Rick. Any thoughts that you have in closing for the audience?
Yeah, I'll just remind all of us, we do have a great healthcare system. It's very expensive. Let's open our minds and our hearts and be willing to think outside of the box. And I have such great faith in the entrepreneurs and the bright people that are integrated into our healthcare system at all levels: insurance companies, new businesses, employers, providers, clinicians, doctors, hospitals. We're going to get there, but it'll take some risk, and that's the fun part of what we're all looking at these days.
Love closing on a note of hope. That's awesome.
Yeah.
Thanks, Rick. Appreciate you coming
All
on
right.
today.
Thanks, Lindsay. Good seeing you.